Now, headaches, facial pain, fatigue, if you are suffering from sinus symptoms, there's a procedure that can help. Dr. Kevin Smith with American Sinus Institute is here to explain, along with patient Ashley Hoffman. Welcome to the show.
Thank you for having us.
So over the last month here in Houston, so many people have been talking about ragweed and all of these allergens that have been driving them crazy. So a lot of people take medication and, hope the problem goes away, but in many cases it doesn't.
It doesn't. I mean, when it becomes chronic and you're taking medicine after medicine and you're not getting any better, then it's time to come see us at the American Sinus Institute.
Now, what you guys do there, I'm going to have you describe the procedure a little bit. You actually use a balloon?
Yes, it's a small balloon that actually goes into the nose and up into the sinuses, has a little wire that guides the balloon into the sinus, and then we just blow it up. Once we're there, we blow up the balloon and it opens up the channels, and then you go to the other side, you blow up that balloon over there and come out, and there are about 6 of those sinuses that we can do with the balloons.
So tell us what we're seeing a little bit, this video right now then. This is the process you just described.
Yeah, that's the guide catheter going in, and there's the wire. It has a light on the end of it, so we can actually thread that, and once it gets into the sinus, you'll see a little halo, a little glow into the sinus. The balloon is then threaded over the wire and expanded, perform some microfractures here that you see, and now we have a larger channel than we did before.
Wow.
We can irrigate the sinus, we can flush it out.
So those microfractures you're describing, that's actually the cracking of these tiny little bones. So once that balloon expands the space, it stays open.
It stays open, yeah, 98% patency rate.
Wow. Now, Ashley, you had this procedure done.
I did, just over 2 months ago. Had a lot of headaches, a lot of facial pain and pressure, and I have not had a headache since the day I walked out of that office.
It's so interesting. And you were telling me before the show that you used to, when you would go running, you would have trouble breathing, and you thought, oh, well, this is just normal. I'm running.
I did. I didn't realize that, I was having trouble breathing. I just thought running isn't fun and it's really hard. And that was it. And since having the procedure done, when I run, it is so much easier to breathe. So like I said, I didn't realize I had a problem until it was fixed. And I feel like a lot of us feel that way a lot of the time. You don't realize how bad it is until it's not bad anymore.
And Dr. Smith, when someone is experiencing symptoms, I mean, how do we know when something is just a normal allergy response or something that's more serious?
Well, normal allergies, you're going to have generally some sneezing, some itchy nose, watery eyes. That may be temporary if it's a seasonal problem. But if this is a chronic thing and you're finding yourself at the drugstore every month just filling up on all these medications, it's time to get something done. Usually we see people who don't breathe well. They have a lot of postnasal drainage or runny nose, headaches, pressure in the ears, pain in the ears, drainage in the back of the throat. And all these things will combine to just not make you feel your very best. Once you have the procedure done, the patients generally can go back to work the next day. They have very little pain. The recovery period's a day or two.
And this is outpatient, right? So people just come into your office. How does it work? Like if I think I'm having sinus problems or if I'm having headaches or trouble breathing, I come to your office and then what?
You come to the office, you'll be greeted by our wonderful staff, and then you'll go and you'll actually get a CAT scan of your sinuses right there in the office. So the CAT scan will show us the anatomy, what actually is going on in that sinus cavity. Then once we've done that, then we will set you up to have the procedure done. The procedure takes about 20 minutes. It's general anesthesia.
20 minutes?
It's covered by insurance, and it is an outpatient procedure. So you go home the same day, you rest that day, and the next day you get up and you can go do what you normally would do.
You wake up and run a marathon. We're seeing some video right now of what goes on in your office. So once someone gets the scan then, you guys can go over the results immediately.
Exactly.
And you can what kind of thing are you looking for? Things are you looking for in a scan?
You can see polyps in the nose. You can see cysts in the sinuses. You can see a deviated septum. You can see enlarged turbinates. I know these are all medical terms that don't make sense to you, but these are structures in the nose that are normally very active and they do their own part. But once there's an anatomical problem with one of those or multiple of those, then you get the problems with the headaches and the pressure and the ear pain and the inability to breathe.
Now, I have known, I was also telling you before the show that in 6th grade, one of my best friends had a sinus surgery where they essentially cut open his face and sort of did this massive thing. Yep. This procedure, the balloon thing, really has been a game changer.
It is. It is a game changer. When you look at something where you can use these delicate instruments and achieve a result and make people feel better, takes only a few minutes and a shorter recovery time. It's just the advancement of medicine and how it's become lately. There's no packing in the nose. It's just a very cool procedure to do.
Ashley, when you had your surgery done, tell us about the recovery process when you were done.
There wasn't really one. I was a little sleepy that day from the anesthesia. The next day, I was up and running around like nothing had happened. No bruising, no swelling, like some of the horror stories you've heard in the past about sinus surgery.
Well, didn't you have like pain or soreness, though, from where?
None. I had no discomfort from the time that I woke up through today.
Is that typical, that people wouldn't feel any pain?
You know, it really is typical, and it's difficult for me to tell patients, you know, we don't really have pain. We'll give you some pain medicine to take, but it's more like discomfort. People know they had something done, but it's not something you would describe as pain or just excruciating pain. We just don't get that. And it's hard for me to say it because people will go, you know, I'm sure, doctor. I talked to my friend. They had sinus surgery before, and they said it's the worst thing they ever did.
Yeah.
We don't get that at American Sinus Institute.
So why is it then that someone might have a bad experience elsewhere with, because this is a procedure that I guess a lot of people are doing now.
Yeah. Some doctors may not do it, may not be trained in doing it. Other people might have had it long ago when the traditional endoscopic sinus surgery, where you would actually remove tissue, was the standard treatment. So this is not that. This is just dilating up the normal drainage passages and making people better.
Wow. So go to the right person is what you're saying, right?
Go to the right person.
Go to you
right.
guys. And how long have you guys been doing this procedure?
This procedure, Dr. Hanrubi has been doing for, I know, about 6 to 8 years. It's been around that long. And his technique is one that we do there in the office. It's been perfected over that time. And that's why we can do so many of them, and we do them so quickly and efficiently.
Now you have me wondering, I've been sort of sniffing through this segment thinking, am I breathing
Come
as
see
well
us.
as I can? Maybe I'll come see you.
We'll take care of you.
All right, Dr. Kevin Smith, Ashley, thank you so much for coming in. And to schedule an appointment with American Sinus Institute, you can call 713-BALLOON, which is 713-225-5666, or visit their website, americansinus.com.